Hello everyone. Welcome to Pediatrics by Dr. Anand. First of all, I want to tell the topic of choice today's video, which is how to study pediatrics for final year MBBS students. Thank you, sir, for making this video possible because these are the questions which has been asked in our YouTube channel, on the Instagram page, and on Facebook also. Thank you for sparing the time to enlighten our students.
Great. Thank you so much, ma'am. I think that's a very important topic you have chosen today. Yes. Yeah.
So I want to start with the first question, sir. How to study pediatrics? Sir, for the MBBS students, it's a big thing. Like pediatrics is so new to them. Apart from the other subjects, they have an interesting subject. They just know that it's about the children. But how to study pediatrics, sir?
Yeah, so that's a very simple but yet very important question you have asked today. So I'll come to the main thing, how to study pediatrics. Number one, you should have a theory book and you should have a clinical book. The best theory book for anyone to study for final year pediatrics is OP Ghai 10th edition, and the practical book we should read is Piyush Gupta Clinicals of Pediatrics. That is the first thing you should have if you're starting your final year MBBS as pediatric subject.
Yes, sir. So for the theory, the books are different. For practicals, again, the book is different. So students are always like, they want that clarity. Thank you for enlightening us, sir. And we want to know the topics unique in pediatrics, which is apart from the common medicine topics.
Okay. So everyone who is reading pediatrics, make sure you're reading the book properly. And sometimes we have this habit of some topics naturally overlap. As in vaccine is there in community medicine also, is in pediatrics also. Breastfeeding is there in gynae also, pediatrics also. So many topics are overlapping. But again, I would like to say that whatever is there in the OP guide, at least one simple go you must go through regarding the book. Don't have this habit that that this is half medicine or half any other subjects. Follow the book properly, and that's it. Don't confuse with another subjects. That's all I can say. Yeah.
Thank you, sir. The next question being, how does it feel to be a pediatrician, sir? And what is the lifestyle of a pediatrician?
It feels amazing to be a pediatrician, and the whole story starts from your final year only. That's why I'm saying that once you attend your clinical postings and ward rounds, so that is one very crucial time where you will finally decide whether you have interest in this field or not. That's why, being a final year, I always tell the students, spend as much time as possible in your clinical postings. Make friends with your SRs or JRs or interns who are there, who are your seniors basically. Make friends with them, and in the evening, once you're free from hostel or dinner or something, just go to the pediatric ward or NICU or PICU, or to the labor room where the babies are being delivered, and try to just analyze the part of that life, that whether are you comfortable, are you very excited to be there, or you're not excited. So once you follow that step properly, then the further life of being a pediatrician becomes very meaningful and very easy. That's what.
You're one of the blessed people, sir.
No, I am blessed because I have juniors like you.
Thank you, sir. Thank you, sir. What is the role of postings from second year MBBS to final year MBBS, sir?
Yeah, this is very, very important. Postings play a very huge role. As we all know, in the theory question, the clinical question, they're asking all clinical based question. A 5-year-old came scissoring, how will you manage? A newborn came with jaundice, what is the best diagnosis? So for all that, clinical postings plays a very important role. And they're very beautifully divided into system-wise cases, like respiratory, cardiac, CNS, like that. So posting undoubtedly play an important role. And one simple important advice, second year and third year, whatever postings of pediatrics are going on, make one proper book, okay, normal notebook, and that should be little thick, okay. Whatever cases, random cases, or whatever you see in your second and third year, please keep that book very safely, and in your final year, keep continuing writing in that book only, because there is something known as muscle memory. even though you forget also, at least in the final year, if you flip the previous pages, no, oh yeah, I read this also. Oh, I did a case presentation. Okay, I did kilocalories, how to require in a baby and all that. So a lot of muscle memory comes back. So that is the simple information I can tell you. If you're a second year, take one register, write pediatrics over there. And if you're very happy, write pediatrics by Dr. Anand. Until final year, just follow that book only, and it's going to be very helpful.
Thank you, sir. Now I'm reminded of the workbooks of yours also, which shared a lot of knowledge for us and built our confidence in pediatrics posting. So
Yeah, luckily, and
the next question being,
thankfully, we are coming with a book also known as One Touch Pediatrics. It's only for the final year students. It's 100 pages book which has all the important pointers for postings as well as theory. Once the book is out, we'll share it with everyone to all the rest of the planet. And it's in a very simple manner, but it's gonna be amazing. Yeah. Yes.
continue rocking, sir. The next
Yes, ma'am.
question being, should students study final year MBBS from apps and videos or just stick to textbooks?
Yes. Again, a very important question and a very important answer. Read textbooks. Read your textbook. Now, this era of life has been very dangerous to us. It's been beneficial as well as very dangerous. Videos are in a very system, like all these various digital platform app videos, they are very nice to the point and all that. But are they giving you the real textbook information? I don't think so. The textbook will always remain the textbook. That underline which you do from pencil, no, and write some extra point over there. Like after 5 years, also, it will be very helpful. So there is no doubt about it that you please, whatever subject it is, make sure you give time and read the textbook without fail. Once you're done with the textbook and all that, yes, definitely watch the videos of any subject and enjoy those videos. Your knowledge will be 5 times better. But if you're relying everything on the video, I don't have time, only videos I will see and all that, it's gonna be a sad story in the future. Yeah.
So that cleared the doubt of many students. This is an important question, and we have other questions also from the students, which is studying pediatrics same for final year MBBS and NEET PG entrance exam? So
Yeah, right. So that's what. So now it's a very thin line because final year is pediatrics, and just after final year is a NEET PG, where again pediatrics subject is one of the clinical main final year subjects. So how can we club this together and make it useful? So whatever topics you are reading in final year, imagine you read a topic of vaccines or milestones from OPGI. Make sure you do the MCQs for any of the books of the MCQ entrance book. Make sure you do one theory topic followed by MCQ. Do one theory topic followed by MCQ. Nowadays, we have a lot of chapter system-wise MCQ booklets we have. If you guys don't have or you want to have that, we have our mobile number on 9999897081, where we have this group. We keep sharing the 5 questions per day policy of the recent 3 year questions. So that also becomes very easy for all of us to have a very quick, simple revision, which is important. So if you're studying final year followed by a PG preparation, do one topic followed by MCQ. Do one topic followed by MCQ. You cover both ways then. Yeah.
thank you so much, sir. Now I'm also reminded about your advice of following one book for my INI CET preparation also. So when I did
Yeah.
MCQs, you suggested me the book and you told me to stick with the same book for the MCQs. Thank
Yeah,
you,
that's
sir.
what my thank you. And even my HOD also used to say that instead of reading 10 books at one time, you read one book 10 times. So that is one thing. Instead of reading 10 different books only one time, you read one book 10 times because its knowledge is the same only. It's just that we have this era of FOMO, fear of missing out, that I will miss that. No, no, let me read that. But you end up forgetting everything. So that's what. And congratulations, Dr. Ara Nishashri, for your finishing your MBBS curriculum, and now I'm sure you're gonna be one of the best doctors in South India.
Thank you so much, sir. Your blessings.
No, and you're always been my
What are
favorite
the
from so
do's?
many years. Yes.
Yes, sir. What are the do's and don'ts for final year MBBS students pertaining to pediatrics, sir?
Right. So, okay, let's go on the don'ts first. As in number one, being a final year student, what I should not do. Number one, don't rely much on the videos of whatever app you're studying. because that is not enough. You need to read the textbook, because they're asking proper question from textbook. If you divide your days properly, you can do very nicely. So one thing which a final year student should not do is, number one, directly doing the MCQs or directly watching the videos, even directly doing the MCQs also. I've seen people directly doing the MCQs. Read the topic, then do the MCQ. People are thinking they are going retrospective, like I'll do the MCQ, then I'll read the theory topic. It's going to be very difficult. So one, that thing is there. And second, important advice which you should do is follow your postings very religiously. They are very important, because that only cases are going to come in the exam. Same severe acute malnutrition, whatever you see in final year, will come in the exam. And newborn baby is a compulsory short case which has to come in exam. This one, instruments, drug, NRP, these are very basic stations which are this is like a basic thing for any medical college for passing MBBS. So whatever they tell you in posting, whether it's a half an hour or 4 hours of posting, make sure you go home and try to analyze what did I study today, which topic it was. For as a renal system is concerned, nephrotic will always be a case for final year long case presentation. So go home and read nephrotic. So basically postings are important. Don't miss even a single day, even though they teach you very nice or horribly. You go, you'll learn something for sure. And secondly, don't directly jump to the MCQ directly on the rapid revision of any video content. Follow the textbook, read book, and then go. That's what.
Thank you for patiently answering all the questions, sir.
Yes, ma'am.
The final question is, what is the one advice you would give students watching you internationally, sir?
Yeah. So one advice, like one good advice. So I always say that uh, try to like see one beautiful advice I want to give is like final year is the end of your MBBS curriculum. Okay. So by the end of final year, you are acclimatized with a lot of subjects: anat, physio, biochem, committee, ophtha, so many. Now it's not a first year or second year where you don't know what is going to happen in third year. Final year is like a dead end. उसके बाद खत्म, finish MBBS. Okay, so one advice I want to give is like keep asking yourself, that which subject is your favorite, or where are you feeling most comfortable at. That is very important for us to analyze and realize, because it's very difficult later. Sir, I finished my internship, finished my MBBS, I only don't know which subject I like the most, or do I like suturing more, or do I want to be in the labor room attending a cesarean section, where I want to be, so it's very important. First we need to think, then only we will be over there. If you're not thinking only randomly like a blind, we are going everywhere, it's difficult. Keep checking out, keep talking to yourself. I remember in my first year, once the first year MBBS got over, we had an anatomy teacher, Dr. Padma. She was a gold medalist and all, and she was the best anatomy teacher we have. The way she used to explain cadavers was mind blowing. And by the end of the first year, I used to tell my friends that I have to take anatomy. I will take anatomy. She's the best. She's the best, and all that. And my friends are like, wait, wait, wait. Second year will come. Okay, wait. Then second year came. Second year came one of our pharmacology HOD. Her name also was also Dr. Padma, and she also was gold medalist. The way she used to explain the drugs and all that, and she was so humble. Like morning, she used to come in buses, and evening we used to watch her interview on the TV, and we used to be like very fascinated with her. So humble lady and all that. And I was like, I want to be a pharmacologist without any fail. I want to be a pharmacologist. But students, in this era, they have this myth that this is not doctor, clinical, putting stat, checking patient, ventilation, that is doctor. Anatomy is not a doctor. Micropatho committee, what is this? Not a doctor. Which is not true. Which is every branch is equally very important and very beautiful. And then came final year. Finally, I remember obs gynae, as I have done my UG from South India, from Bangalore. So their male gynecologists are more famous than the female gynecologists. So in my hospital, male gynae units were much more and fully filled with patients than female patients. And then I was like, I want to be a male gynecologist, such a beautiful branch and all that. Our professor used to teach us, was amazing. And they were very positive of me joining a gynae. My mom was like, South India has most famous male gynecologists than female gynecologists. So then that came the thought that, anything is possible and everything is possible. It's not that, but I didn't stop my mind thinking. I was always evaluating. Acha, I want to be this. Okay, I want to be that. So at least that led me somewhere by the end of the journey, being a pediatrician. So that's the message to all the students, that keep discovering yourself, every day, keep before sleeping, keep asking yourself, was I happy in surgery? Was I happy in community medicine? Psychiatry is a very demanding branch these days, a very wonderful branch being a psychiatrist, very strange disorders and all. Some people are get extreme fascinated with psychiatric disorders or psychiatric patients. So follow your passion and keep asking yourself where you feel most comfortable at. And then your next 70 years of your life will be very happy then.
Thank
So
you
I
for the
hope you
valuable
got some
advice,
little
sir. You
knowledge.
always keep motivating us. And yes, yes, definitely, sir. Internationally, students are being benefited by your videos, lectures, and you always start with a motivation quote. Recently, now you have inculcated motivational videos also in the beginning of your lectures. That is one unique thing now you have started.
Yeah.
Thank you for motivating all of us and enlightening our student life because we need a mentor like you, sir.
No, definitely. Thank you so much. I think together we all make one family. And by the end of the story, I think we all are doctors and we all are on the same side. The only difference is today you had an MBBS, tomorrow you will do MD. We all are on the same side. And secondly, we need to uplift the mankind. We need to uplift our society or our way of thinking or discovering or having this courage to face anything. And that only comes once we help each other. So I have seen people getting jealous. I have seen people getting agitated at why are you teaching him, or he should be down, I should be up and all that. But by the end we need to understand we all are on the same side of the river. Just few miles I'm away ahead maybe, but tomorrow you'll come there. And if I help you today, tomorrow someone else will help me. So whatever goes comes back again. So that's why everyone should have a very positive attitude that even though the minutest thing on this planet you want to help someone, help without expecting, and but something will come anyhow someday to you, so that at least that intention should be alive like a small candle, like a spark in your life, and then a lot of then good things will happen. Yeah, thank you so much.
That's a pearl of wisdom. So you are giving us knowledge also and wisdom also, sir. Thank you so much,
Yes,
and
ma'am.
thank you for sparing the time, sir, for your valuable time for all of our students. And with
Thank you,
this,
ma'am.
I end the session. And thank you to all the audience who keep supporting us. The number is 9999897081 for the WhatsApp groups. Follow us on Instagram, Pediatrics by Dr. Anand. Even Facebook, it's pretty easy. The name is famous, Pediatrics by Dr. Anand. Thank you, sir.
Yes, ma'am. Thank you so much for having this interview and having me. I mean, that itself is very wonderful. Thank you so much. And let's keep doing this interview for more such topics. There are got a lot of queries and a lot of new topics are coming on the way. And I think it's time to help everyone. And that's it. Yeah. Thank you so much. Thank you.
Thank you, sir.
Thank you.